As North Carolina begins to emerge from the COVID-19 statewide shutdown order imposed by Governor Roy Cooper, the challenges we face are enormous. Yet, so are the opportunities. COVID-19 has illustrated the great promise of healthcare innovations and free markets to expand access to care and to help lower costs. A way forward with healthcare opportunities is laid out in Carolina Rebound. That is the John Locke Foundation's new game plan for reviving our economy. The healthcare policy analyst who authored part of this new report is here with his recommendations. He is Jordan Roberts. Jordan, welcome back to the show.
Thanks for having me.
Set the stage for us, if you would. How has COVID-19 really impacted healthcare in North Carolina?
Sure. So I think the biggest thing to point out is that, as we saw the early spread of the disease, a lot of the major hospitals and providers, they completely shifted focus. They stopped doing elective procedures. They stopped, doing some of the normal patient procedures that they were doing and switched all their focus to COVID treatment. And that included stocking up on supplies, clearing out whole wings to treat COVID patients. And, that completely changes the whole business model of these providers. They were not getting the income from the elective procedures, and were kind of in a wait-and-see period to see what the influx of COVID patients would be. So a lot of the providers, their entire business plan for this year was interrupted. I think another thing is we've seen just tragic job loss around the entire country, but North Carolina is not immune to that. And so, with the odd arrangement we have in this country where most people get their health insurance from work, when you lose your job, you may lose your health insurance. We've seen, upwards of 1 million people unemployed here in North Carolina. Presumably, a lot of them have lost their health insurance. So that affects families and how they pay for health insurance and things like that. And then, the other thing we've seen is a lot of longstanding healthcare policies that have governed the practice of medicine have been either changed or waived. And so some things that, used to be illegal in the state are now legal. And so we're seeing a changing landscape with the regulatory framework as well.
A big impact, in other words, on healthcare in
Absolutely.
North Carolina. You mentioned the unemployment situation, and it's huge, unfortunately. Oddly enough, at the very time when healthcare workers are on the front lines dealing with COVID-19, there are a lot of healthcare workers that themselves have lost their jobs, and people don't realize that. And it gets us to this question of access to care and medical professionals. First of all, why are healthcare workers being laid off when they're in demand?
Right.
And then how do we make sure that we have access to a larger pool?
Yeah, so it's a peculiar situation as we, reserved all these healthcare workers to treat the influx of COVID patients. Many of the facilities that employed them could not afford to pay them anymore without the elective procedures. So as we need more frontline healthcare workers, some of them had to be laid off because of the financial situation. So that's something we're dealing with. But, in North Carolina, we have one of the most rural populations, a lot of medical deserts, a lot of medically underserved places. And so, we say that this is a maldistribution of providers. We have enough providers in the state. They're just not distributed in an appropriate way to meet the needs of all these communities. And so that's why, a lot of the recommendations in this piece are about increasing access to medical providers, increasing the amount of supply, because one thing we haven't had is an adequate supply around the state. This includes things like opening up licensure restrictions to allow medical providers who hold a license from another state to come into North Carolina and practice, to increase the scope of practice for current providers in the state to allow them to do more for patients. And, things like telemedicine and telehealth allow, same thing as licensing, allow professionals in other states that are in good standing with their medical boards to treat patients in North Carolina. Because right now we actually just restrict access to all of these professionals.
Let's talk about telehealth and telemedicine first, because so many people have been mandated by government in our state, Governor Roy Cooper's statewide shutdown order, to stay home. Jobs eliminated, but yet people still need access to health care, whether it's related to COVID-19 or not. And so we've have seen more people introduced to the idea of communicating with a doctor or a nurse or a pharmacist over their smartphone or their laptop. So oddly enough, it took a pandemic to get more people to realize it is possible to receive quality care this way.
Yeah, absolutely. And so this was already on the rise, but now this pandemic has shown that, a lot of care that we traditionally, go to a brick and mortar doctor's office for, a lot of it can be done over virtual means, such as telehealth video conferencing. But the one thing I want to point out is that even though as we move forward into a more probably digital health oriented world, there are still a lot of state and federal laws that restrict the types of devices one can use, where one must be to receive telehealth, and the insurer pay for it. So there's all these different things that restrict it. And so, one of the recommendations in the paper is just to open up, have a very flexible regulatory framework, so there's not any new technology that's restricted from being used, or a doctor may want to try something that's illegal in North Carolina, things like that.
And Jordan, too, it seems kind of crazy that we're living in a world that is completely interconnected. You can have a conversation with someone who is literally around the world from you. And yet, if you're trying to access medical care, there's a real impediment to trying to access someone who isn't physically within the confines of the state of North Carolina. That seems such old thinking. Yeah,
exactly. And, this is what I point out in the Carolina Rebound recommendations, is that so much of healthcare regulations is sort of this old guard mentality that's, just entrenched interest protecting their turf. And, that's what I really call for, is that, we need to break up these old restrictionist and protectionist policies that have governed the practice of healthcare for so long, because all they do is, limit the amount of supply, limit what doctors can do, and limit how patients can access care. And, with something like medicine and medical care, something so personal to the individual and personal decisions being made between a doctor and a patient, the government should get out of the way and not try to make these decisions for medical providers and patients. And so, all of the recommendations in my section of the Carolina Rebound call for the unwinding of some of these, protectionist policies that have not achieved their goals, and we have 40 or 50 years of evidence of that.
You also point out that some medical professionals are impeded from really providing the full access of their knowledge. You single out nurse practitioners and also pharmacists. Tell us about what they could be doing that right now they can't.
Yeah, so nurse practitioners are, practice a lot in primary care settings, and so in order to practice in North Carolina, they have to go into a collaborative practice agreement with a physician, and so their practice is limited to what their physician allows them to do, and to what if they have a supervising physician on hand. And so what we want to see is that collaborative practice agreement eliminated, so that nurse practitioners can practice however they see fit and wherever they see fit, to help with that maldistribution of supply or of providers. And then on the pharmacist side, what we've seen in other states is that some people, or that some states are allowing pharmacists to take up a few more testing and treatment of non-chronic diseases. So what this does is it utilizes the healthcare infrastructure that we have, and it allows primary care doctors to focus more on some of the big more complicated procedures. So both of those to free up medical providers.